Rosie's House is a Valley nonprofit that provides an after-school music program for underserved students. Now in partnership with Blue Cross Blue Shield and Teros, Rosie's House has developed a mental health program for their students. The program trains faculty members to recognize possible mental health issues and interact with students to get them on the path to help. And for more on this, we welcome Becky Bell Ballard, CEO of Rosie's House. We're also joined by Kimberly McWilliams, Senior Director of Clinical Excellence at Teros. Welcome to you both. Thank you very much for being here.
Thank you for having us.
Becky, let's remind viewers more specifically what Rosie's House does.
Yeah, Rosie's House is all about connecting kids to opportunity and supporting them as they develop their full creative and personal potential. And we do that through music. We have one of the largest 100% free after-school music programs in the country. We're located right in downtown Phoenix, and we have kiddos from all over the Valley, 14 Valley cities, come to our location pre-K through 12th grade, and they're involved in music education in the after-school hours. We're working with families who are economically challenged, under-resourced, and many of our students, kiddos, are in schools that don't have music programs. So we're all about connecting kids to opportunities and eliminating that gap.
So with all that work that's been done, how did the mental health component take place? How long had that been on your mind or on the mind of supporters?
Well, I think anyone who works with kids has been thinking a lot about the challenges around mental health and well-being, especially post-COVID, and with the data and all of the statistics around stress, anxiety, and depression, and then just seeing it show up in our school. And so I was thinking around those challenges, and as an organization supporting kids, like what could be our role? And then I had the incredible opportunity to go to Colombia and see a program in Colombia called Batuta.
Okay.
And in that program, they really marry the idea of social well-being and music. And so that was really the inspiration that I took from that visit. It was part of a fellowship that was awarded by the Piper Trust. Oh. And it really just opened my eyes to the opportunity to support kids in a broader way.
Great. And Kim, how did the partnership come about?
So we were lucky enough to meet Becky and her team at Rosie's House and learned about the wonderful music program that they had. Teros has a very robust children's program for mental health, and we noticed the same thing Rosie's House had. Kids post-pandemic had increased anxiety, depression, mood issues, school attendance, and we wondered together, what could we do for these kids?
I want to have you both comment on this, but Kim, you first. It really, music has been something, I mean, it goes back to the 17th century. Music soothes the savage beast, or whatever the old phrase goes. So music can be so helpful with this. Did it seem to you that music and mental health would be a good fit to start?
Oh, amazing. I couldn't think of better medicine. The joy that music brings and just that sense of self-esteem for kids to learn and participate and have that experience, it seemed like a dream come true.
Well, Becky, it seems like the fact that Rosie's House already does so much work with music, which is obviously already helping these kids. It just seems, I know you obviously did a tremendous amount of work, but it also almost feels like a no-brainer in some sense. Like, we're already doing this, here is the next natural step. Is that how you felt so far?
That's how it felt. It felt like we're supporting kids in so many ways, and let's think broader. And really, music in our program, the fostering of social connections, has been a powerful, powerful way to combat mental health and just give kids the opportunity to have more positive interactions with their peers. Yeah. And so when we embarked on exploring this partnership, we didn't want to make assumptions. So we did a lot of work with some of our families in focus groups and some surveying to really determine if there was indeed a need for resources. Okay. So we know, what we were doing with music was helping, but what were the other resources that we could help with? And so the data came back and the conversations really came to the place of needing free services for our families who are economically challenged. And so that's where Teros really came in.
Well, is Teros involved in the training, Kim, as far as making sure that both the students are getting a lot out of it, but also some of the workers already there know how to handle things?
Yes, definitely. It's important part of our partnership to really educate the staff on what to look for with mental health concerns with kids.
Okay. And are there certain things that you could share with us that, because I would think someone who's teaching music wouldn't necessarily be thinking about those things. Are there some real basics you can share with us?
Right. With children, really any change in their behavior is a cause for concern. So somebody that might be participating in class, but maybe they're quieter than normal, maybe they're coming later, not participating, really struggling in those areas, those would be cues for staff to really pay attention.
Becky, how has it affected your staff? Have they embraced this concept?
100%.
Okay.
Yeah, I think many of our teachers and team members were concerned and really didn't know what to do. I mean, we're not trained in this arena, and so having Kim and Taros and their team come and train us in what to look for and really provide us with the resource of a referral to suggest that opportunity to families, not to prescribe anything or say we know what's going on, just to say, if you're thinking about this, there's a resource in our community, and that's Taros Health. So Taros has been on our campus quite a few times this past year, just getting the word out with advocacy around reducing the stigma around mental health. And in our survey data at the very end of this year, we had information from our families that 10% participated with Taros Health.
Okay. Just a few seconds, Kim. What else should we leave our listeners and viewers with as far as right now? Like what could be next to expand this, or what are you more excited about?
I think I'm really excited of the response from parents. So I think just getting the word out, letting them know we're here for them, and we don't turn anybody away.
Terrific. Kim, Becky, thank you both for being here. Appreciate it.
Thanks so much.